Welcome and thank you for joining us today for this Epocrates Masterclass. We have an array of speakers to support you in discovering all the ways Epocrates supports you in caring for patients, and we'll share some power tips as well. Feel free to use this table of contents to skip ahead whenever you like. And now, let's begin our Epocrates Masterclass. Hi, I'm Dr. Ann Meneghetti, an internal medicine, pulmonary, and critical care specialist by training. For more than a decade, I've led the medical information team at Epocrates, which includes the physicians and pharmacist drug experts who create and curate the content in Epocrates. Over the years, I've created our guideline synopsis feature, our bugs and drugs software, and our famous Epocrates picture quizzes. Let's go through the Epocrates home screen navigation. Along the top of the screen, just below the search bar, you'll see a scroll of all the different reference content types. And one quick way to get to a full list of all these reference content types is at the very bottom of the screen, where you'll see a list of all these reference content types in one view. Many times people use search, the search bar, as their primary entry point. However, if you know you're interested in, say, a calculator or a guideline synopsis or our drug interaction checker, you can browse just that content type directly from any of these icons. Now, if I tap back to the home icon at the bottom of the screen, I'll get back to the main page. And wherever you are in the app, tapping the home button will get you back to this Epocrates home screen. Also along the bottom of the home page, you'll see several other navigation icons. The notifications icon is where you'll find timely updates. And to the far right is the saved icon. When viewing any clinical content within the app, you can bookmark content to easily find it again. Wherever you see the bookmark tab, tapping it will add the content to this area, and you'll never have to go searching for it again. For example, if I'm on this message, I see the bookmark tab at the bottom, and then it will be saved in my saved file. And you can access it all in a snap. This works for news articles, drugs, guidelines, diseases, calculators, and more. To clear an item from your Save tab, just tap on the three dots right after it and choose Unsave. If you'd like to share an item that's in your Save tab, just click on it and choose the Share button, and you can send it to someone else.
Hello, my name is Leslie Youngs. I'm a pharmacist on the medical information team here at Epocrates. I work with our technical and design teams to ensure that the content and features in Epocrates are accurate, relevant, and practical for clinicians like you. Over the years, I've helped make improvements to our drugs feature, the interaction check tool, and the search experience, just to name a few. The Epocrates drug feature provides essential prescribing information and safety details for thousands of brand, generic, and over-the-counter drugs. The quickest way to navigate to the Epocrates drug information is through the search bar on the home screen. Simply type a drug name into the search bar. In situations where you'd like to learn more about a new or unfamiliar drug and you can't remember the product's name, you can use our Browse feature to find a drug. The Browse feature is also helpful when you're considering different drug options and need to see a list of related drugs. To browse the drug topics in Epocrates, open the Drugs section. This screen gives you the option to search or browse. Below the search bar, you can see the list labeled Browse Drug Classes. To browse, you will use our two levels of classification, drug class and subclass. First, select a drug class from the list. Let's select psychiatric. This is the list of the drug subclasses under the psychiatric class. As you can see from this list, Epocrates subclasses can be therapeutic, such as bipolar disorder, or pharmacologic, such as SSRIs. Let's select SSRIs. Now you can see the list of all SSRI drugs in the psychiatric class. Tapping on any of the drug names listed here will take you directly to the selected drug topic. In this list, notice how there are separate listings for generic and brand name products. For example, we see Celexa, a brand name product, and citalopram, a generic product, as separate items in the list. It is important to understand that these two listings will not take you to the same drug content. Epocrates provides drug topics with product-specific information. This means that there is a unique drug topic for each brand name product, as well as a separate drug topic for the generic product when one is available. Brand and generic products can differ in the available formulations, indications, and dosing. For example, the citalopram generic product is available as an oral solution, but the brand product Celexa is not. Brand and generic products often have different manufacturers and pricing as well. In Epocrates, a generic drug topic covers only the strengths and forms available on the U.S. market as a generic product. Likewise, each brand topic is specific to that brand name product. Let's take a closer look at the Epocrates drug content. Imagine you have an adult patient with newly diagnosed neuropathic pain and you would like to start her on gabapentin. Before writing the prescription, you need to review the drug information for gabapentin and verify the appropriate start dose. Let's go back to the Epocrates home screen by tapping the home icon. Search for gabapentin. Select gabapentin from the search suggestions and navigate to this topic by selecting the name. Using the intuitive drug topic menu, you can quickly navigate to the specific information you're looking for. Let's select adult indications and dosing to find the appropriate dose for your patient. At the top of this section, Dosage Forms gives you a list of the available forms of this product. Below Dosage Forms, you can see a list of indications and uses for the drug, with the appropriate dosing below each indication or use. You can quickly find neuropathic pain on this screen and review the dosing information below it. Notice how neuropathic pain is marked as an off-label use. Epocrates includes both FDA-approved indications and off-label uses and dosing. Off-label uses are always clearly labeled with the words off-label after the use. Now let's scroll down to the bottom of this section. Following all of the indications and uses, you will find information about dose adjustments for patients with renal or hepatic impairment. In this example, for gabapentin, we see specific dose adjustments for different levels of renal impairment based on creatinine clearance and dosing guidance for patients on dialysis. After you've reviewed the adult dosing section, simply tap the back arrow to return to the main menu for this drug topic. Before prescribing gabapentin to your patient, you'd also like to review the information about adverse reactions to educate your patient on what they may expect and note any serious reactions to look out for. From the menu, select the Adverse Reactions section. This section includes a list of serious and common reactions. Serious reactions are included regardless of incidence. These effects are typically grouped by organ system or severity. The decision to include an effect as a serious reaction is based on its potential to cause death, require major medical intervention, or result in significant morbidity, dependence, or abuse. Under common reactions, Epocrates includes all adverse drug reactions and lab abnormalities reported in at least 2% of patients at a recommended dose for any indication that occur more frequently in the treatment group than the placebo group. This may vary for products in which such information isn't available. For example, if the data is reported differently in the product labeling, such as greater than 1% or greater than 5%. Common reactions for prescription drugs are generally listed in descending order of frequency. For over-the-counter products, common reactions are listed alphabetically in Epocrates. If an adverse reaction doesn't meet our inclusion criteria as a serious or common reaction, but is is nonetheless serious, severe, frequent, and or strongly associated with the use of a drug, it will be included at the end of the common reactions section. The epocrates formulary feature provides health insurance drug coverage details for over 7,000 plans. It includes information about prior authorizations, step therapy requirements, and other restrictions. This content is provided by a trusted source, Managed Markets Insight and Technology, and is updated in epocrates on a weekly basis. Imagine you have a patient with asthma who has been taking the brand name product Dulera. When you ask her about her medications, she says her inhaler is so expensive that she can't afford it anymore. You want to help her find another drug that will be more affordable. She has insurance, so you will use the epocrates formulary feature to look up drug coverage based on her health plan. From the epocrates home screen, you can select the formulary section to select the appropriate formulary plan for your patient. This is your list of saved formularies, which are your 30 most recently viewed plans. You can simply tap a saved formulary plan name from this list to select that plan. The red check mark indicates which plan is currently selected. If the plan that you are looking for is not on this list, you can add a new formulary. Let's try it. You can use the search bar to find the plan by name. Filters for state and type of formulary, such as PPO, HMO, government, etc., can also help you narrow the list to find the correct plan. The state filter is automatically set to your state. If you'd like to clear this filter and broaden the search to all plans in all states, you can tap the filter and select all states. I'd like to find a PPO plan for my patient in Washington. Let me narrow the list using the filters. Now I can use the search bar or simply browse my narrowed list to find the plan I'm looking for. The plan I'm looking for is Regents Blue Shield Washington PPO 6 tier. So I can select this one from the list. The red check mark indicates that I've selected that plan. Now tap Add One Formulary. This plan is now selected and added to your saved formularies list for quick access in the future. Tap the back arrow to return to the epocrates home screen. To view the insurance coverage for a specific drug, we need to go to a drug topic. Let's look up the drug that the patient is taking, Dulera. We can type the name in the search bar and navigate to that drug topic. To find insurance coverage information, tap the insurance plan name displayed at the top of the screen in blue. Below the selected plan name, you can see the coverage level for Dulera. It says 3QL, which is Tier 3, and quantity limits apply. Under the formulation heading, you can see one formulation listed. Tap See More to see the full list of coverage codes and details by formulation. All formulations are Tier 3 with quantity limits, so you can understand how this could be quite expensive for your patient, even with insurance. You'd like to find another option with better coverage in a lower tier. Directly below the coverage details by formulation, you can see a section for drugs in same subclass. When you collapse the first list, you can see that Dulera belongs to two subclasses, the long-acting beta-2 agonists and the inhaled corticosteroids. You can use these lists to explore insurance coverage for other drugs in the same subclasses. Do you ever get questions from patients about dietary supplements and natural medicines? For example, is this supplement effective? How much should I take? Is it safe to take with my other prescription medications? The Epocrates Herbs and Supplement feature can help you find answers. This feature, which is available with a paid subscription to Epocrates Plus, provides you with evidence-based details on dietary supplements and natural medicines. Each topic covers uses, dosing, cautions, adverse reactions, and drug interactions. Let's take a brief tour of one of these topics. The quickest way to navigate to an herb or supplement topic is through the search bar on the epocrates home screen. If you'd like to browse all available topics, open the Herbs and Supplements feature to find a full list of topics in alphabetical order. Imagine a patient is asking you about CoQ10. We can use the search bar here within the Herbs and Supplements feature, or we could have used the search bar back on the epocrates home screen to find this specific topic. Let's type CoQ10 into the search bar and navigate to this topic. This is the supplement topic for coenzyme Q10, also known as CoQ10. Using the menu of sections, you can quickly find the information that you're looking for. Let's take a closer look at the Reported Uses section. Select Reported Uses. This section provides an alphabetical list of reported uses for this product. Notice how each use is followed by an effectiveness rating in brackets. Tap the back button to return to the main menu. To find dosing information, select the Reported Doses section. This section presents reported doses by use, along with the effectiveness ratings. Notice that the link labeled Calculate Dose is present when the use includes any weight-based doses. This link takes you to the Epocrates weight-based dosing calculator so you can quickly calculate the dose for your patient when needed. Let's tap the back button to return to the main menu. From any screen within the herb or supplement topic, you can find the Interaction Check tool in the top right corner. It's the triangle with the pills. Tapping this icon will take you to the Epocrates Interaction Check tool, where you can quickly check for potential interactions with up to 30 products, including prescription drugs, over-the-counter drugs, or other herbs and supplement products. With Epocrates Plus, you have evidence-based information at your fingertips to confidently answer your patient's questions about dietary supplements and natural medicines. The Epocrates Interaction Check tool allows you to check for potentially harmful interactions between up to 30 brand, generic, and over-the-counter drugs at a time. With a paid subscription to Epocrates Plus, you can also check for interactions with herbs and supplement products that your patient may be taking, such as melatonin or fish oil. Let's imagine that you have a patient with high blood pressure and chronic pain who is newly diagnosed with depression. Before you prescribe an antidepressant, you can use Epocrates to check for potential interactions with your patient's current medications. Here's how. From the Epocrates home screen, the quickest way to access the Interaction Check tool is by selecting this feature listed directly below the Epocrates search bar. Note that you can also access this tool through the References tab at the bottom of the screen or from the toolbar found at the top of any drug topic. Tap Interaction Check to open the tool. After clicking Interaction Check, you can start entering your patient's medication list. Your patient is currently taking low pressure HCT, tramadol, and Zestrol, so let's add those drugs. Click on the red plus to add a new drug to the list. Then use the search bar to look for the drug name. As you start typing a drug name, you'll see suggestions that can be selected. Tap on Low Pressure HCT from the suggestions. Low Pressure HCT has now been added to your selected drugs list. To continue building your list, simply start typing the next drug name into the search bar, then select it from the suggestions. Add all of your patient's current medications to the list, plus the new antidepressant Zoloft that you want to prescribe. Now that you have all of your drugs on the list, tap Confirm Drug List. Based on the drug list you created, you can now view potential interactions. The results screen indicates that potential interactions exist between one or more drug pairs in your list. At the bottom of the results screen, there may also be additional considerations that you should know about. Here we see the additional considerations for sertraline in Zoloft and tramadol. Let's scroll back to the top of the results screen. To view the interaction details for a specific drug pair, such as tramadol and Zoloft, tap Show Details. As you can see in this example, the action statement gives you guidance on what to do to manage the potential drug interaction. The Filter by Drug feature allows you to view the results from a different perspective by focusing on a specific drug. For example, if you want to see only the drug interactions and additional considerations for the new drug that you're planning to prescribe, you can tap on Filter by Drug, then select Zoloft. This shows you only the results that are relevant to Zoloft. For multi-ingredient products, one or more of that product's ingredients may interact with other drugs on your list. For example, here we see that both ingredients in low pressor HCT interact with Zoloft. Tap Show Details to see more. Notice how there is information for each interacting ingredient pair, hydrochlorothiazide and sertraline, and then metoprolol and sertraline. Epocrates helps you understand drug interactions at the ingredient level. At any point, you can easily clear the filter by tapping Clear Filter in the top right corner of the screen. This takes you back to the full list of results. From the results screen, tapping on any drug name takes you to that Epocrates drug topic. For example, tap on Zestrol to quickly navigate to that drug topic in Epocrates. To go back to the interaction check results that you were just looking at, simply tap the back arrow. At any point, if you need to make changes to the list of drugs in the interaction check tool, you can do this on the drug list screen. Tap the back arrow to return to your drug list. This is where you can remove or add another drug or over-the-counter medication. Epocrates drug interaction content is created by our in-house team of expert clinicians. We provide you with practical, actionable advice about drug interactions so that you can confidently make decisions and keep your patients safe.
Hi, my name is Dr. Walt Haddigan. I'm a member of the Medical Information Team and Director of Clinical Content at Epocrates. I lead a group of editors who are responsible for creating content found in the Epocrates Newsfeed, Guidelines, and our Labs feature. For those times when a particular piece of drug or disease-related clinical data doesn't quite fit into the standard format of other sections of the Epocrates app, such as drug or disease information, Reference Tables likely has your answer. For example, imagine you're seeing a patient who's interested in starting birth control, specifically oral contraception. Now, choosing from among the myriad of combination oral contraceptives can be daunting, even for the most seasoned clinician. Now, in cases like this, the OCP hormonal activity table can be very handy. So let's open the Reference Tables section of the app. Now, we can locate the OCP hormonal activity tool either by typing in the search bar at the top, OCP, or we can tap on the OB-GYN section, and there we see the OCP hormonal activity table listed there. Tapping into that table will then show the various OCP options arranged by their endometrial, progestational, and androgenic activities. Now, let's say our patient is also experiencing acne or hirsutism. So we'll want to choose an OCP with low androgenic activity. And we can see the androgenic is the third of the lettered activities for each group. So we're going to want to see a group of OCPs with the L in the third position. This particular grouping here, but we'll not want this one. Scrolling down a little further, here's some other options. And if we want to go to a fully anti-androgenic option, the last three sets at the bottom will be good choices for us. Let's say another patient comes in and she's experiencing heavy menstrual bleeding. an OCP with higher endometrial activity might be a better choice for that patient. So we might want to choose an OCP option from this group with medium activity, or go right to something like Natasia, which has high endometrial activity. And a couple of other examples of frequently viewed reference tables provide information on dose equivalencies. For example, the corticosteroid equivalence table allows easy comparison of glucocorticoid and mineralocorticoid activity among various agents. And another example is the ACE inhibitor comparison, which allows a clinician to switch between ACE inhibitors with confidence. And just like other Epocrates content, frequently used tables can be saved for quick access later by tapping the bookmark icon at the top right of the screen.
Hello, my name is Lynn Van, and I'm a pharmacist and leader in the drug information team here at Epocrates. I manage the infectious diseases content, including drugs as they relate to guidelines, and the infectious diseases treatment selector. You're prescribing acetaminophen in a pediatric patient, and you want to determine the appropriate dosage based on the child's weight and age. So let's first click on reference and drugs and type in acetaminophen and select the drug acetaminophen, and we'll go to the PEDS indications and dosing. Looking at the PO route infant/children option here, you see that there is a calculate dose link. So let's click on that, and that will take you to a very helpful calculator within Epocrates, the dosing calculator, where if you're coming from the drug monograph, it will bring in the indication and dosing information in addition to the dosage forms, which is very helpful. And in this case, we're looking at, for dosage, 10 to 15 milligrams per kilogram per dose. So under dosage, let's enter 10 and select the units of milligram per kilogram per dose. Under the patient's weight, we're going to include 25 pounds. And because this is the liquid form that you'd like to give to this young child, let's select liquid under the form. And scrolling back up, you see that the liquid solution under forms is in the concentration of 160 milligrams per 5 ml in this case. So we will enter under liquid concentration 160, the units being milligrams per 5 mLs. And we'll select view results. And the calculator will nicely share what the dosing results are in the specific dose, 113.4 milligrams per dose, and also in the liquid amount, which is 3.5 milliliters per dose. Let's go back to the main page and look at how to identify the dosing calculator on its own. As an example of a different calculator, let's click on reference and go to calculators. And we're going to look at body mass index. So under search calculators, let's type in BMI. And there are many options, but we're going to select the BMI percentiles and z-scores for females 2 to 20 years old, CDC. So the third option here. And we'll click into this specific calculator. And let's calculate the BMI for a 6-year-old. Under age, we will put in 6 with the units year. For height, we'll enter 44 inches. Enter 25 under weight. And we'll click on done. And here you'll see that the BMI results populate with a BMI of 20 and the percentiles. If you scroll down further, there's also BMI classification based on the CDC, and in this case, it would be class 1 obesity. And if you need more information, there are notes further down in addition to our references.
The Epocrates Diseases feature, which is part of the Epocrates Plus subscription, includes more than 1,000 topics covering the most frequently encountered conditions in clinical practice. Now, these can be accessed via the search bar at the top of the home screen, for example, searching for asthma in adults this way, or by tapping into the diseases section itself and using the search bar there to search for diverticular disease, for example, or by browsing by specialty, for example, dermatology, and then clicking into the acne rosacea topic. Now, these standard disease topics provide easy to navigate, quick reference sections that align with workflow during a typical office visit, starting with things like history and exam, tests to order, differential diagnosis, and finally treatment options, where recommendations are arranged by specific patient type for rapid reference. Now, a collection of unique evaluation topics provides decision support with a focus on the differential diagnosis of common symptoms or findings, such as this one on anosmia evaluation. So let's imagine we're in clinic and we need some support managing a patient with suspected COPD. Now, here on the reference page of the app, let's tap into the diseases section here in the center of the screen. Typing COPD will then take us to the COPD disease topic with its 5 quick reference sections displayed right up front. A high-level overview of the condition, highlights and basics, is on top, followed by 4 sections arranged in order of workflow during a typical office visit. So firstly, under history and exam, we'll find a list of risk factors and key diagnostic findings. Tapping into any item, such as cough, shows a brief description of that finding specific for COPD. Next, we see tests. Tapping on any test, for example, spirometry at the top, will show results that support a diagnosis of COPD. Now, before we're ready to jump into treatment, a differential diagnosis section lists other conditions to consider in a patient suspected of having COPD. Tapping into any differential will show a brief description of that condition, for example, asthma here, with a link to its own full disease topic at the bottom. But let's say we're pretty confident in our diagnosis of COPD in this patient, and we're ready to move on to treatment. Under treatment options, we're going to see that patient-centric stratification that I mentioned earlier. Let's tap into Gold Group B, Initial Treatment, to see first and second line treatment options listed for our patient. Tapping at the very top into LABA/LAMA, we'll see various long-acting beta agonist and muscarinic antagonist combos. Tapping on any drug name will take us instantly to the Epocrates drug information for that product, with all of its sections listed, including formulary information always in view right here near the top, allowing informed treatment decisions to optimize drug affordability. Now, before we leave the COPD topic, we can save it for later by tapping the bookmark icon at the top right for even quicker access later. For those times when you're faced with an abnormal lab test result and the reason behind it isn't immediately clear, the Epocrates lab reference, which is part of the Epocrates Plus subscription, comes in very handy. Imagine you've ordered a serum ferritin in a 40-year-old male patient who's vegan and has been complaining of fatigue and weakness. The serum ferritin result is 17, which the lab report indicates is below the normal range. So let's delve into ferritin a little more. Going to the Epocrates Labs section, we'll type in ferritin, and then clicking on that lab test will reveal the lab information for ferritin. At the top is a brief description of the test. A little further down is a reference range, in which case here we see for an adult male, 20 to 250 is normal. And under lab result, because our patient has a low ferritin, we're going to tap on low to reveal a list of potential causes and contributing factors, including conditions and drugs. Now, tapping on iron deficiency anemia, for example, we can see some more information here where less than 10 nanograms per milliliter is considered diagnostic. So our patient isn't quite there yet. But we do find that recommended follow-up labs, if we're considering iron deficiency anemia, include a serum iron, a total iron binding capacity, and a CBC if not already ordered. Now, for completeness, let's look at other potential causes. Tapping into protein deficiency, we see a list of possible underlying causes of protein deficiency, as well as recommended follow-up labs if protein deficiency is suspected, in this case, albumin and prealbumin. And note, whenever a disease or a drug cause is listed, and Epocrates has a separate topic for it, it's always just a click away. So for example, tapping on iron deficiency here will take us to the iron deficiency anemia disease topic. And just like for most other content in the Epocrates app, tapping on the bookmark icon at the top right of the screen will save this lab for quicker access later. Clinicians sometimes need a comprehensive review of a disease, like what's found in the Epocrates Diseases tool, but other times they seek expert society recommendations for diagnosis and management, which can be found in clinical practice guidelines. However, original guidelines from specialty societies are often lengthy and complex, making them impractical for point-of-care use. Over the past decade, Epocrates has built a library of over 150 guidelines, synopses, and syntheses, offering quick, accessible answers from either single societies in our synopses or from multiple expert perspectives in our guideline syntheses. So let's imagine a patient who's been having long-standing GI complaints presents to the office today following a urea breath test that returned positive results for H. pylori. Now, with so many potential treatment options available, it can be difficult to choose the best one for our patient. So let's navigate to the Epocrates Guidelines library, and we can use the search bar at the top to search for H. pylori. Tapping on the search suggestion will take us to the H. pylori treatment regimens guideline synthesis. On the landing page of this guideline synthesis, you'll find some key points, followed by a listing of specific patient groups. Now, here's where you'll be able to drill down to specific recommendations that match the patient you're treating. In this case, we're going to tap on adult awaiting initial therapy, and then we're going to choose no history of macrolide exposure, and local clarithromycin resistance is low, less than 15%. And we know our patient does not have a penicillin allergy, so that will be our last click. And that will then reveal the various treatment options recommended by the American College of Gastroenterology in the first column. To the right of that are the Canadian guidelines from the Toronto Consensus, and finally the European guidelines at the far right. Now here you can see the various different treatment options recommended, such as the bismuth quadruple therapy, concomitant therapy, and others. And beneath the table are some extra treatment considerations provided in a concise bulleted list. Now, at the top, toggling over to the Resources tab, we can see links to full text guidelines. For example, this link takes us to the ACG guideline, if we so wish, as well as explanations for acronyms used in this guideline. And just like most other content in the Epocrates app, guidelines can be saved for rapid access later by tapping the bookmark icon at the top of the screen. Then later, you can access that guideline from your saved folder. And here we can see it in our recently added saved file.
Imagine you're working in urgent care and seeing a patient who's been bitten by a dog. You can look for the latest antibiotic recommendations in Tx Selector. So let's tap on the reference and the Petri dish icon. From the body systems list on this landing page here, let's tap onto skin and soft tissue, followed by bites, and let's tap on dog. You'll first see the empiric therapy tab, and this lists antibiotic combinations in the order of preference. And let's assume that your patient does not have a penicillin allergy, then amoxicillin clavulanate would be the usual drug of choice to cover for bacteria, including Pasteurella. You can also select the specific drug itself. So we're going to click on amoxicillin clavulanate, and let's select the generic. And this will take you to drug information with indications and dosing, as well as drug information and much more information here. Let's go back to ID Treatment Selector. On the second tab is Specific Therapy, and this will look very similar to empiric therapy, except for now the antibiotic recommendations are listed under specific organisms, and in this case, bacteria. If you have culture results with specific bacteria, you can use the information on this tab to tailor your antibiotic regimen. And the last tab for info contains additional information regarding history, including some symptoms, and in this case, sequelae. There's also information about diagnoses, as well as treatment, which includes, in this case, treatment duration. And at the bottom of this section, you'll see our references.
Let's explore bugs and drugs. As the only patented solution of its kind, Bugs and Drugs is an antimicrobial susceptibility tool that supports clinicians in making optimal empiric therapy decisions by surfacing a list of bacteria observed for geolocated communities across the country and antibiotic drug options based on organism susceptibility. Let's tap on the Bugs and Drugs icon and imagine you're seeing a patient with classic UTI symptoms and you'd like to prescribe some antibiotics. Using the patient's zip code, you can identify common drugs in their community. So we'll go ahead and tap in a zip code 94121 for San Francisco, select that option, and then select Next. The results here list organisms based on the number of isolates for that specific zip code, 94121. And even though you know that E. coli is the most common cause of UTIs, using Bugs and Drugs will allow you to select the most appropriate empiric antibiotic based on that specific local susceptibility. Let's tap on E. coli for this area, and you'll see various drug options based on susceptibility on the right. The drug options are listed alphabetically, so you can look and scroll down for the various susceptibilities. And based on your patient's specific factors, you can decide which drug would be the most optimal. For instance, if you're looking for an oral therapy, nitrofurantoin might be a good choice. Feel free to tap on nitrofurantoin, and that will bring you to the drug information page, including drug dosing as well as drug interactions. An elderly patient with dementia is brought to the ER after a fall, and she's there with her son. Before you prescribe pain medications for her broken wrist, you need to determine what medication she's on. Her son doesn't know the name of his mother's medications, but he has her pill box with her. Tap on Reference, select the pill ID icon. From the pill box, one of the tablets has an imprint of 12 on one side and X on the other side. So under imprint codes, we're going to type in 12 for side 1 and X for side 2. If we view the matches, you'll see at the bottom here that there are 9 matches. In order to narrow that down further, we can include the shape of the pill, which in this case is round. And now we end up with 2 matches. Let's click on the View 2 Matches. As you can see here, there are pictures of the tablets. And in this case, when compared to the pill box, you know that the patient is on donepezil. From this page, you can select on donepezil and get to the drug information monograph, where you can identify the dosing and drug interactions and other information. Let's go back and reset, because now you're going to look at the second pill. Side 1 contains the number 20, so let's enter that in. And side 2 contains the letter X, but it looks like there's something else that you can't read. By entering these 2 imprint codes, you'll have 15 matches. So let's try to narrow it down further, because you know that the pill is triangular shape. Let's select 3-sided for the shape. And now there's only 1 match. Let's select View 1 Match. And that looks exactly like the pill in her pill box.
Let's take a brief tour of the Epocrates newsfeed. In the center of the Epocrates home screen, beneath the search bar and the reference quick navigation ribbon, you'll see the header Medical News for You. With articles added daily, you can catch up on all the latest medical news, including a curated selection of summaries of medical journal articles, breaking news stories, updates and alerts from FDA and CDC, and much more. Let's tap into an article as an example. Here's one based on a study presented at the recent European Society of Cardiology meeting. Here we can see the brief summary, at the bottom of which is a PubMed link, if desired. And beneath that is a selection of suggested articles with similar themes. Each article can be liked, shared, or saved by tapping on these icons at the bottom right. Engaging with any of these buttons will actually increase the likelihood of seeing similar articles higher up in your personalized newsfeed experience. Also in the newsfeed, you'll find short quizzes that test your diagnostic skills and drug knowledge. Here's one now. Now, for those with a competitive streak, tapping on any answer option will reveal what proportion of other respondents answered similarly. So you can see how your answers stack up against your peers. And just like with articles, quizzes can be liked, shared, or saved for later. And to retrieve those saved items, simply go to your saved folder by tapping the bookmark icon in the thumb navigation bar at the bottom of the home screen. And there you'll see that quiz and article that we just saved.
Your account settings and profile information are accessible by clicking the avatar icon in the top right. This takes you to your profile. If you need to update your email or password, just click the Manage Profile, and you can change your name and email and password here. Going back, you can also contact our support team by clicking the gear wheel settings at the top right of your profile. Here we have links to help and support, frequently asked questions, and abbreviations and other information about Epocrates. Tapping the back arrow will take you back to your profile, and from here you can get back to your home screen. Thank you for joining us today for this Epocrates Masterclass. We hope these videos have equipped you with the tools and knowledge to make the most of your Epocrates app. The power of Epocrates lies in its ability to streamline your workflow and enhance the care you deliver to patients. If you have any questions or comments, please reach out to us through the Help and Support section in your Epocrates app profile settings. Thank you again for your participation. We look forward to seeing you again at our next webinar.